This morning, the Finance Committee meets to discuss ways to improve Social Security after a difficult pandemic year. The employees at Social Security have worked hard to get payments out on time while undergoing big changes to the way the agency operates. Despite that, the reality is social distancing and Social Security go together like water and oil. The Social Security Administration has tens of thousands of employees and 1,500 field offices around the country. 16 of those offices and more than 500 employees serve Oregon alone. It takes a lot of hard work to uphold the promise of Social Security, and that work often looks awfully old school. Face-to-face interaction and lots of paper documents. Social Security closed their field offices when the country went into lockdown. That's because gathering seniors and those with disabilities in confined offices would have been the worst imaginable idea 12 months ago. Social Security also needed to protect their own employees. But the fact is, the level of service dipped when Social Security's old school approach no longer worked during the pandemic. Being cut off from face-to-face service is hardest on seniors and folks who rely the most on Social Security. And so often they have very modest incomes and may not even have internet access. The number of new applications for certain types of Social Security benefits plummeted during the pandemic. There's an extra layer of difficulty coming between a lot of Americans and Social Security benefits they're eligible to receive. With fewer employees working in person, work that cannot be handled remotely, such as handling mail or verifying documents, has piled up. Social Security's ability to process applications and other important data has slowed. Some Americans have been asked to put their most sensitive personal documents in the mail, not a copy, the original, including driver's licenses and birth certificates. That would have been an unattractive prospect to a lot of people, even before Louis DeJoy arrived at the post office, at the Postal Service. These days, particularly because of the pandemic, the big challenge facing Social Security is reaching people who are unable or prefer not to deal with the government online. In the future, Social Security could face the opposite challenge. More people will want to interact with Social Security through a smartphone or a computer, and the face-to-face approach may be less common. When you're talking about changing business as usual at Social Security, it's not just a question of responding to the pandemic. There are big challenges ahead. This committee and the Social Security Administration need to explore new ways of meeting the needs of Americans to provide the benefits they've earned, need, and deserve. Making smart improvements to Social Security based on the experience of COVID-19 can pay off big in the future. All of these areas fall under the far-out revolutionary agenda I describe as making government actually work better. There's never been a more important time, as far as I'm concerned, for Social Security. For me, this hard work goes back to the days when I was co-director of the Oregon Gray Panthers and ran the legal aid service for the elderly. In the course of that job, I visited with a lot of seniors who are walking an economic tightrope, barely able to cover their bills. Social Security was a lifesaver for them. For too many of today's seniors, we still find them going through that kind of hardship, and it's made even more difficult by a global pandemic and a year of isolation. So this committee on our watch is going to uphold the promise of Social Security. I'm glad we're going to be able to have this opportunity to discuss improving access to the benefits and services. We've got excellent witnesses today. We'll have their introduction shortly. Senator Crapo.
Thank you, Mr. Chairman, for holding today's hearing on Social Security service delivery during the pandemic. Social Security employees were informed in March of last year that they would be teleworking indefinitely and that field offices would be closed to the public because of the COVID-19 pandemic. Within days of announcing a shutdown, the majority of field office employees and a large number of teleservice center employees were teleworking. Initial challenges included lack of equipment, software licensing, and data capacity. The leadership, management, and the workforce at the Social Security Administration responded rapidly to increase data capacity and stabilize networks after only a few weeks. During the pandemic, conducting office and processing center work in person was not possible because of lockdowns and worker safety concerns. With those constraints, SSA has had to innovate, relax some procedural rules, and perform in many previously untested ways. Thus far, the agency has performed admirably and rapidly to ensure that beneficiaries, including at-risk populations, obtain the services they need. I've been impressed by the dedication and diligence of SSA's workforce, the field office and processing center managers and leadership, all the way to the top. Customer service and service delivery have been at the forefront of their efforts during the pandemic. We're fortunate to have SSA's head of operations, Ms. Grace Kim, with us today. I'm interested in her assessment of where SSA has been during the pandemic, where things stand currently, and lessons learned thus far to help us inform the future. From the beginning of the pandemic, field office management staff have continued to physically go into the offices to handle incoming and outgoing mail, scan documents, and support those working from home, provide in-person service for critical need cases, and handle facility-related duties. Ms. Peggy Murphy is also with us today, and I look forward to hearing about her experience and insight as a representative of field office management. I'm also interested in the experiences and service delivery perspectives of our other two witnesses, Ms. McGinnis and Mr. Kozai. I hope I pronounced that right. During the pandemic, it has been important to focus on at-risk populations, including many on supplemental security income, disability insurance beneficiaries, and homeless beneficiaries. I'm interested in hearing today about service delivery to at-risk beneficiaries and outreach. My understanding is that Social Security Administration has engaged in an unprecedented amount of outreach to community organizations, beneficiary advocate organizations, and directly to at-risk beneficiaries themselves. I commend the Social Security Administration's commitment and dedication to ensure that beneficiaries receive their service and benefits. Commissioner Saul has stayed true to the focus on beneficiary service that we all expected when he was confirmed on a bipartisan basis by this committee and the full Senate. Solid leadership and a dedicated workforce have been key to enabling the agency to confront the service delivery shock of the pandemic. Thus far, the SSA has risen to that challenge. Thank you, Mr. Chairman.
Thank you, Senator Crapo. Now I'd like to introduce our four witnesses. Our first witness will be Ms. Grace Kim, Deputy Commissioner of Operations at Social Security. She's headquartered in Baltimore. She's joining us today from San Francisco. Our next witness, Cascader Kozai, is up early in my hometown of Portland, Oregon. He is Program Manager at Central City Concern. Central City helps those with life's biggest challenges to end or avoid homelessness and build healthy, housing, resilient, and engaged lives. Cass, as he's known to his friends by, heads up BEST, Benefits and Entitlement Specialist Team, and works with the homeless to assist them in applying for benefits. Our third witness will be Peggy Murphy, immediate past president of the National Council of Social Security Management Associations. Ms. Murphy is the district manager of the Social Security Office in Great Falls, Montana. And our final witness is Tara Dawson McGinnis, the founder of the New Practice Lab and a senior advisor at New America in Washington, D.C. We'll begin with you, Ms. Kim.
Chairman Wyden, Ranking Member Crapo, and members of the committee. I am Grace Kim, Deputy Commissioner for Operations at the Social Security Administration. In my current position as a former regional commissioner and as a career SSA employee for over 30 years, I understand how vital SSA's programs and services are to the public. Thank you for inviting me to discuss our service delivery during the coronavirus pandemic. I appreciate the opportunity to share some of our accomplishments and challenges as we prioritize health and safety while delivering vital services. I am so proud of the agency's employees who have worked to serve our customers despite their own personal challenges during the pandemic. It is my honor to lead over 44,000 employees in more than 1,200 local field offices, 24 teleservice centers, and 8 processing centers. I'm also pleased to oversee the work of the 15,000 employees in the disability determination services, the state agencies that make our medical determinations. Since the beginning of this crisis, Commissioner Andrew Saul's priority has been safety for our employees and the public. Many of the people we serve, older individuals and those with serious health conditions, are at a higher risk for the effects of COVID-19. To allow for physical distancing and to limit close contact, in March 2020, we made the unprecedented decision to have our employees work from home and to limit in-person services to appointment only. No one anticipated the length of the pandemic, but we have been working hard throughout the last year to implement policies that support the public and focus on delivering mission-critical services. We published our local field office phone numbers. We extended timeframes to submit documents. During a critical period in the pandemic, we deferred certain workloads to preserve beneficiaries' income and health care. Due to the uncertain course of the pandemic and our stewardship obligations, we resumed most workloads late last year and provided flexibilities to help the public. We are implementing new ideas to expand access to our programs and reduce paper workloads, like creating electronic signature options and an online process for Medicare Part B supplemental medical coverage. For customers who must visit a field office, we developed service options that limit time spent in the office, like the option to submit evidence in secure drop boxes and shortened interview times. We are testing an online video process that allows certain U.S. citizens to apply for replacement Social Security cards. We are also using video to hold certain consultative examinations and hearings to make disability decisions. Helping our most vulnerable populations, individuals with low income, limited English proficiency, homelessness, or mental illness access our services is our priority. To reach them, we expanded outreach to these groups through close partnerships with community-based advocates and ongoing robust targeted outreach efforts. The pandemic has also created workload challenges. Some work can only be handled in the office, like issuing certain Social Security cards and processing and scanning mail. We depend on nearly 3,000 field office employees each day, mostly managers and volunteers, to process these non-portable workloads on site. These workloads have increased dramatically since the beginning of the pandemic. Our field offices are handling 3 times as many phone calls compared to pre-pandemic, and on-site employees are scanning over 1.5 million documents per week, 10 times the volume before the pandemic. Scanning these documents into our system is a workaround we put in place to allow our employees to work remotely, but this process also reduces our productivity. Like much of the world, we have been affected by the challenges caused by the pandemic. The fiscal year 2022 SSA discretionary budget request of nearly $14.2 billion, which is $1.3 billion more than what we received this year, will strengthen our service to the public. We hope you will support this request. I want to thank the public for their continued cooperation, and especially our extraordinary employees who care so much for the people we serve, and you for being patient and supportive of our mission during this national health emergency. I look forward to answering any questions you may have.
Thank you very much, Ms. Kim. And now, up early in my hometown, Cascader Kozai. Welcome.
Thank you. Chairman Wyden, Ranking Member Crapo, and members of the committee. My name is Cascader Kozai. I am a program manager for the Benefits and Entitlement Specialist Team, BEST, for Central City Concern in Portland, Oregon. On the board of directors for New Narrative, formerly Luke Dorff, and a member of SOAR's National Expert Panel, all organizations serving people experiencing poverty and homelessness. My team has been using the SOAR model for developing and filing our claims since 2008. SOAR, a national project funded by the Substance Abuse and Mental Health Services Administration, was designed to help increase access to SSI, SSD for people with severe conditions that could not go through the SSA disability process on their own. Since 2020, the barriers for needing Social Security benefits have increased in various ways. Applicants just can't walk into the field office, and prearranged appointments are hard to get. This means people have trouble getting help understanding the nuances of going through the disability process. For example, a woman new to homelessness, listening to the myths about SSA and disability, suffering from residual effects of a severe bipolar decompensation, being so disorganized and afraid that she slept on the sidewalks during the day and began using meth at night to stay awake for fear of being harmed. She's going to struggle until she finds help. 2, people might not always have a working phone number, a mailing address, a printer, or a way to check mail if Social Security tries to get in touch with them. For those without necessary technology and understanding to begin and complete the process, there is limited or no access to SSA staff and information that could help them complete applications and the various other tasks requested of them. We helped a person with an intellectual disability who was estranged from his family and choosing to live on the street rather than to admit to his family that he just couldn't understand things. 3, increase hopelessness and feelings of apathy for those attempting to become more self-sufficient, like an older gentleman suffering from a multitude of conditions who had been falling through the social service cracks for decades, losing trust in systems that his life will ever have any meaning, and even losing trust in those who attempted to help him. Fortunately, the people I've described here were all the lucky ones because they were able to get help from BEST. But there are so many more that can't access my program and are just as ill and vulnerable. Although these issues exist in all homeless communities, it is particularly true for Blacks, Native Americans, and Latinx communities who disproportionately experience homelessness at higher rates compared to their white counterparts. A few statistics from my program related to years prior to the pandemic compared to during the pandemic. For the 3 years prior to March 2020, we averaged 806 referrals a year, and average time to an SSA decision was 79 days. Since March of 2020, we received 673 referrals, and time to an SSA decision is 110 days. National numbers reflect this local trend. Many people suffering from severe and persistent conditions have nothing in the way of resources to help them survive. The maximum of $794 a month they get from SSI is still below the federal poverty level, but can open housing doors, offer the ability to get from place to place using public transportation for things like primary care appointments and counseling, can offer some hope for the future and allow them to set their own level of self-sufficiency and quality of life that previously wasn't available to them. So here's some possible solutions. Safely reopen SSA field offices for drop-in appointments. Make the SSA application available online and simplify the questions. The current My Social Security electronic access is too complicated for most people and requires an email address that not everyone has or can remember passwords to. People should be able to access SSA services with their Social Security number, even if all they can do is schedule a phone call. People also don't have phone minutes to wait on hold for 40 minutes or more. More funding for nonprofit organizations to help vulnerable people apply for SSI and SSD. More flexible scheduled call-in times for the public. The COVID pandemic has caused us to rethink how we do what needs to be done and what the new normal will look like. Let's consider making things a little easier for those whose abilities are a little more challenged than ours. Thank you for listening to my testimony, and I look forward to answering your questions.
Cass, thank you. And Central City Concern in Portland has been there for vulnerable folks since my days with the Gray Panthers. And I just want everybody there to know how much we appreciate the incredible leadership. Our next witness is going to be Peggy Murphy, past president of the National Council of Social Security Management Association.
Hello, Chairman Wyden, Ranking Member Crapo, and members of the committee. My name is Peggy Murphy. In addition to being the immediate past president of NICSMA, I am the district manager of the Great Falls, Montana Social Security Office. On behalf of the National Council, thank you for the opportunity to be here today to provide our frontline perspective of SSA service during the pandemic. On Friday, March 17th, 2020, the majority of Social Security employees were informed that effective Monday, March 20th, they would be teleworking indefinitely and that field offices would be closed to the public because of the pandemic. This was a colossal undertaking given that most employees had never teleworked and our telework pilot had just ended a few months before. We rose to the occasion, and within a couple of weeks, the majority of field office employees and a large number of teleservice center employees were up and running, taking care of customers from home. I managed 4 offices that had not been part of the telework pilot, and my employees were not so interested in teleworking. We met the challenge though, and my employees went home on Friday and were successfully serving customers on Monday. My employees were anxious about working from home, and like the rest of the world, we did not expect this to go on as long as it has. 13 months into it, I can say that my employees, my management team, and I are very proud of the way we were able to mobilize and continue to serve the public. I'm confident that customers in my service area are being served regardless of how they contact us. However, there have been many challenges. I have 4 Indian reservations in my service area that prior to the pandemic had access to us via video service delivery. Through existing partnerships, we continue to serve those customers via phone and online services and look forward to expanding those services again. Due to our current policies and the nature of SSA's work, dedicated field office management staff have continued to come into the office every day to handle incoming and outgoing mail, non-portable work, and to provide in-person service for critical cases such as immediate payments. This current model is not sustainable because it leaves managers with very little time to perform their duties, which includes facility and personnel responsibilities. Most of our employees remain at home while managers are in the office. Each office is managing their own unique service area challenges the best they possibly can, and some face additional obstacles depending on size, location, demographics, and available resources. We have realized advantages of telework, and so have our employees. However, we need to reopen our offices with the right mix of office workers and teleworkers to ensure customers are getting the service they need, and in some cases that is definitely face-to-face. It was not until fall of 2020 that a very small number of non-management employees began returning to field offices on a voluntary and rotational basis to assist with the substantial volume of incoming and outgoing mail. In most cases, there are between 1 and 3 employees coming into the office to assist. Besides increasing on-site personnel, SSA has made efforts to improve public access to facilities. These efforts include field office drop boxes and the use of Microsoft Teams to conduct certain enumeration interviews. Overall, the agency's response to serving the public during COVID-19 has shown our commitment to serving the public. However, in order to overcome our pre-existing inefficiencies and apply the lessons learned, SSA needs resources. We need frontline staff, and even with the recent investments in IT modernization, SSA's computer systems continue to have many challenges. We continue to rely on 40-year-old COBOL systems. SSA must continue to modernize. We must expand existing services and implement technologies that will assist our more vulnerable populations, including the deaf and hard of hearing community, non-English speaking customers, the homeless, those who live in rural and tribal locations. It is critically important that Congress and SSA address the need to approve upon outdated program policy that makes administering SSA's programs inefficient, costly, and ultimately does not provide the level of service the public expects and deserves. The pandemic caused us to reevaluate some of our existing policies and make changes quickly to gain efficiencies that we need to build on post-pandemic. Agency leadership has placed customer service at the forefront, has made every effort to provide the full range of services to the American public. The pandemic has changed the agency and the way we serve the public. We must take this opportunity to reassess the customer experience and what it means to provide world-class service. Our agency's limitations with IT, policy, and resources became more apparent once the pandemic hit. Closing offices and relying on management to serve and support our staff working from home made matters even worse. This is the moment where SSA must redefine itself and move into the 21st century. Thank you for the opportunity to be here today and to provide our frontline perspective. We are committed to the mission of the agency and giving the American public the best customer service they deserve.
Thank you very much, Ms. Murphy. Our final witness will be Tara Dawson McGinnis, founder of the New Practice Lab and an advisor at New America.
Thank you very much, Chairman Wyden, Ranking Member Crapo, and members of the committee. I'm so grateful to join you and these tremendous public servants this morning to talk about really making the federal government work for the public. President Lincoln was perhaps the first president to truly drill down on this question: how are we delivering benefits to those who elected us? In my new book, I talk about how he would open the doors to the White House after breakfast and hear not only from government officials, but from citizens, welcoming their petitions and concerns. But as the US has grown to 10 times the size of the populace of Lincoln's time, the practicality of this exercise has changed. Not to mention the dynamics of being in a global pandemic. The challenge, however, remains for today's agency leaders. How can government adapt to reach people in this digital age? Just because government structures were built for a different time doesn't mean they can't adapt. You've heard that a bit this morning. This is very hard. Massive digitization has come to the private sector, and very few of the Fortune 500 companies around at the turn of the century actually just survived this disruption. While companies can be replaced by startups, the government is not going to be replaced. It needs to adapt to meet the time. Millions of Americans depend on it, and there are new tools to do this. The modern equivalent of Lincoln's one-man effort to understand what citizens need. There are new units in the U.S. Digital Services and 18F, and there's growing capacities that are happening at the state level. There are nonprofits like mine that work to serve and help people make this adaptation. And we've seen even in the federal government, new possibilities. Another agency inside the Food and Nutrition Services moved to remote validation for food assistance and served millions more people during the pandemic. This process takes work, but it isn't impossible. I want to highlight one example in the state of Michigan, which once had America's longest public benefits application. 40 pages long, this form was an inhumane barrier between the people desperately in need for emergency services and the state of Michigan. One resident described it as being left up to fate as to whether you make it through. And this was borne out in the data of how many people got stuck in the process. A team of remarkable agency leaders and one nonprofit named Sevilla tackled this form. The results were stunning. The form can now be completed in 20 minutes, and it's processed by the state in half the time. Michigan is not alone. Similar transformations have happened across the country, from California's work on SNAP to Vermont's benefit processing. I want to share 4 key lessons from existing efforts across the country to improve benefit delivery. They apply to Social Security and other agencies, and they come from the work from a book of surveying these across the country called Power to the Public. First, increasing outreach doesn't help if the front door is locked. You heard this earlier in the testimony. Agency leaders need to think of their forms and applications as the front door. They're often the equivalent of either a locked gate or a welcome mat that says need not apply. Agency leaders, and I'm very sympathetic to the role of public servants in these times. I've often been in the seats of other witnesses, but we need to test our forms with typical beneficiaries. Grab a group of beneficiaries and see where people get stuck before you subject millions of people to these forms. You can collect data about what questions aren't working. Many times, backlogs of envelopes are the result of a single confusing question that requires agencies to request more information and more processors to process this. Second, we need to map the user experience, the client journey, end to end. Very often, there is no single person in charge of an application process end to end. One part of an agency runs a call center, another part runs a website. We need to trace the journey and what it feels like to someone on it from the beginning to the end to really understand where the bottlenecks are. Third, we need to measure what matters in real time. Agency administrators need real-time data to see who they're serving, be able to understand that there are decreases in certain populations without doing retroactive analysis. Finally, one word of caution about modernizing, and I think you could hear this, there are some client populations that may never be served through an online process. But many government agencies have taken to digitizing a broken process. And when you digitize a broken process, you get a digitized broken process. In more than one instance, Governments have tried to turn an existing process digital to find it makes things worse. Making services delivery work is about understanding truly who you serve, really engaging the frontline office leaders and adjudicators who work with them. Some of the best innovations come from frontline agency offices, and being able to monitor and see the application end to end and make changes. This can't happen if call centers are short-staffed or agency budgets are crunched. In closing, I'm so grateful for the attention this committee has paid to how these benefits really reach people. While policy matters a great deal, it matters very little if it doesn't reach those who need it most when they need it most in crisis. Thank you very much.
Thank you very much, Ms. McGinnis. And colleagues, we're going to have a number of votes at 11:30, and so we're going to keep this to 5-minute rounds. Ms. Kim, if I could begin with you, can you hear me? Great. As I mentioned in my statement, one of the problems delivering first-rate service is the requirement that some people have to put their most sensitive and important documents in the U.S. mail. Now, I think we all understand why some people are reluctant to do that, and they just can't get by without their driver's license. If they do mail their documents, it can take weeks to get the documents back. So why don't you begin by telling us what Social Security is doing to fix this clearly unacceptable issue?
So thank you, Senator Wyden, for that question. And we share your concern and the concern of the members of the public who have had to mail in those types of original documents in order for proof of their various transactions. Usually it's enumeration transactions. We've put a number of things in place to mitigate the need for our public to have to mail in their primary forms of evidence, such as driver's licenses, state IDs, and those sorts of identity proofs. For states that have our online replacement card in place, we have a data exchange with the driver's license, the DMV, and in those states, we're able to conduct no change replacement card applications entirely online and by video. So that is one way that we've been able to prevent members of the public from having to part with their primary forms of identification. We've also instituted secure drop boxes. So in every field office where it's appropriate and we're able to place one, we have put in these secure drop boxes where members of the public can drop off their proofs of identity instead of relying on the mail, which in the beginning of the pandemic was causing a delay. They can drop those identity proofs in those drop boxes instead of mailing them, and then we can process those documents there. Currently, during the pandemic, we are also being very flexible with our policies. So now, in appropriate situations, we are allowing members of the public to provide secondary types of identity proofs of identity instead of driver's licenses, passports, and things of that nature. So we're certified medical records might be an appropriate form of verifying someone's identity. There are other types of documents other than driver's licenses that we will accept as verification of someone's identity.
Ms. Kim, because time is short, we've got to get this straightened out. I mean, there are too many people for whom this is a huge burden because they need their driver's licenses if they go for other government services. There are various other places they visit, businesses and elsewhere. So we're going to follow this up with you, and I recognize that there may be a bit of politics associated with this as well. But I want you to know, as chairman of this committee, I'm committed to getting this corrected. We can't have people's original documents flying around in the mail and, putting it in a Dropbox and wondering when it's going to get returned and the like. We just absolutely have to do better because these are some of the most vulnerable people. One other question for you, if I might. Members of Congress wrote the agency asking about the decline in applications in November and what the agency was doing to reach at-risk populations. The agency said that you all were doing targeted mailings to a number of people, that you got 200,000 letters. What are the results so far, and what has been done as a result of those responses?
So, Senator Wyden, we initially identified about 2 million Title II beneficiaries who might be eligible for SSI. And so what we did was we sent notices to the first 200,000 of those individuals to let them know that you might be eligible for SSI, and invite them to apply if they believe that they were eligible. After that 200,000 mailing, which concluded in March, we analyzed the results of that mailing, further refined the universe of the individuals who might be eligible for SSI. And now we've identified a remaining universe of approximately 1.2 million individuals who we will begin to reach out to in June. So we will be sending out notices to 1.2 million individuals, notifying them that they might be eligible for SSI and inviting them to contact us if they think so.
I'm over my time, Ms. Kim, and I would like a written answer to that question within 10 days, specifically what you all heard in those mailings and when, with dates and times, those reforms are going to be put in place. Thank you very much. Senator Crapo.
Thank you very much, Mr. Chairman. And you actually took a couple of my questions. You're focused on the same kind of things that I wanted to focus on. So I'll go beyond that. Let me start also with you, Ms. Kim. One of the lessons that I think we've learned in terms of our healthcare system is that the telehealth that we resorted to during the pandemic has become a really significant improvement in our healthcare system that I think Senator Wyden and I agree on this, we need to try to figure out how to make permanent the adjustments and improvements that we made to telehealth as we go past the pandemic. The question I have for you is kind of a broad one here. Do you believe that the experience that Social Security has gone through during the pandemic has given an increased and appropriate focus on digital service, on Social Security service, if you will?
Senator Crapo, I believe that during the pandemic, we have definitely focused on where we can use digital services to enable us to overcome some of the challenges that we faced during the pandemic. So in terms of processing our disability applications, the DDSs, the state agencies that adjudicate disability claims, they were successfully using telehealth consultative examinations for psychiatric and psychological cases in order to get evidence to support those claims. So our experience using telehealth in that arena has been very, very successful. I'd like to be able to see us broaden the ability to use video in that manner to be able to enhance and help our disability process.
All right, thank you very much. And Ms. McGinnis raised the question, she kind of made, I think, a very significant analogy. She said that the front door, if I understood her right, may be too restrictive, meaning, and she referred there to the forms and applications that people need to provide in order to gain access to Social Security to get in that front door. Do you agree with that? And how can, I think that most Americans can immediately identify with the notion that a government agency's forms and applications are a real problem. Do you agree that there's a way we can significantly improve access by addressing the complexity and sort of the restrictiveness of the forms and applications that we currently use?
I do, Senator, and in fact, what we're looking at right now is our SSI application. That is a lengthy application, more than 20 pages long. And the detail of information that is required in that application has been a barrier in the past for the agency on putting that application online. So the agency during the pandemic has been working across components within the agency and with community-based advocates. This is an initiative that we are working on with advocate groups around the country. And what we are looking to do is to simplify the SSI application so that it is much easier and much more approachable for individuals who are applying for that benefit. And then eventually, once we are able to streamline that, put it online for those individuals who would be able to access it online. But I do agree that there are some of our applications that are very, very difficult for the members of the public who need them.
Well, thank you. And for my last minute, I'd like to go to Ms. McGinnis and ask you in this area, would you elaborate a little more about what you were referring to when you talked about that problem we have with forms and applications and getting in the front door?
Certainly, Senator. I think having been a person at a federal agency overseeing forms, I know how much I don't know about how the average person experiences forms. And so the best way to improve these is to allow the people for whom you're designing programs to try them out. It's unexpected what acronyms they get caught on, and you can dramatically reduce the front load work of folks in offices by understanding that nobody knows where to find their EIN number. So when it comes to forms, I think the first piece is test them out on the actual humans. See, collect a little data. 40 people filling out a form will tell you what percentage of people really get stuck on number 2. Try to improve it. Test the forms again on 40 humans before you send the forms to 2 million humans. There are excellent best practices. I can't say enough about the tremendous work in the state of Michigan. The same thing is happening in California. The committee is interested in more models of what forms look like. There are teams inside the federal government and outside that are experts on this. If we can improve and make it easy to purchase a pair of shoes on the internet, Lord knows we can make it easier for seniors to get their benefits.
Thank you. I appreciate it.
Thank you. Thank you, Senator Crapo. You're being way too logical, Ms. McGinnis, to actually test some of these forms on people. That is far too logical. Senator Stabenow.
Well, good morning, and thank you, Mr. Chairman, and our great ranking member for this really important discussion. I just have to start out and join all of us in echoing thank you to the staff, the people who have remained during this pandemic and kept things going when the whole world and workplace was turned upside down because of COVID-19. And so it's important to learn those lessons. I think there's a lot of things that we can learn going forward and that we need to learn. But first, a big thank you. I have been sitting here this morning also with a smile on my face as Ms. McGinnis, you're talking about Michigan. And I know that, and I appreciate your citing our reform of the application process for a number of benefits, especially the form used to apply for benefits, which was one of the longest and most Byzantine in America, I think. You described the tangible relief that the people who need these benefits felt after the reform, that they could successfully apply, get answers from the state much faster, and they really focus on the problems for people who are getting through the application process. And so it was hard work, but I'm very proud of what Michigan did. But I wonder if you might just talk a little bit more about applying what Michigan did to the Social Security Administration. And can you talk more about mapping the user experience for accessing benefits, especially for beneficiaries who may be older or not have access to technology to apply?
Certainly, Senator. I think many agencies at the state and federal level have found the mapping of the experience of a journey, and this needs to be done. We've talked this morning about a couple of different types of benefits. Social Security users are not the same for SSDI as they may be for other benefits. Really understanding who is the average user, or 70% of people in communities that don't have internet access, and taking, and this is done by frontline staff as well as community partners like we've heard from this morning. You take the step by step, and you literally map it out. What happens first? We fill out, a 20-page application. Then who receives it? What is the average wait time for the reception? What does it take to pass go? What share of the forms need to go back to the original beneficiary for more information? Often, if forms are 100% correct on the first go, they're very quickly processed. But in many agencies, you have upwards of 40%, and this is true from everything from your EITC at IRS or your child tax credit or an unemployment insurance. Very frequently, federal agencies spend a ton of effort going back to people and asking them for more information. This is expensive, this is costly, people miss the letter in the mail. And so mapping step to step from when a form is filled out to what share of forms get stuck, to how they get adjudicated, to how a person knows where they are on the journey, sometimes taking pressure off of call centers. This has been the case in unemployment insurance. 90% of people are calling for one thing. If you could make it clearer that they could check on their own on a website, you could make it easier to get through. So it is literally making a map of what the experience is. And this type of map needs to be made with beneficiaries, but also with frontline workers who have done tremendous work through COVID to try to make this work.
Great, thank you very much. And then Mr. Kozai, thank you so much for all of your great work and for talking about the reality for folks that you're working with, trying to work through this system. And I wonder if there's anything else you would want to share with us about the human toll that the delays and difficulties in applying for benefits take on people in need as you're working with them.
Can you hear me?
Yes.
Okay, good. Okay. Yeah, people who are living outside or who are close to being outside, who have severe mental health conditions, these questions that are asked on the applications are just overwhelming for them. You know, you have many people who suffer from anxiety disorders and they can't focus long enough, or they can't get over the fear that's inside them with when it comes to dealing with having to trust, excuse me for saying it, but trust the government. Okay, a lot of our people, they really have a problem with trusting the government, and I'm not sure where that comes from, but it's very difficult for those people. It's also difficult for people who are housebound because of physical conditions to actually get to a place where they can get access to a computer or to have a phone or someone who can assist them. So the office closures are very difficult on these groups of people.
Thank you. Thank you very much, Mr. Chairman. Look forward to working with you to make this system better.
We will be working together. Cass, thanks so much for that really thoughtful answer. Our next senators in line of appearance, Senator Menendez, are you there? Senator Thune. There's Senator Menendez. Yes, Senator Menendez.
Thank you, Mr. Chairman. Ms. Kim, I have a constituent who was on SSI and was laid off during the pandemic. They followed Social Security rules and filed for emergency unemployment that Congress authorized last spring. However, because of their unemployment benefits, they now have a large amount of unearned income, and their SSI benefits were suspended. If they run through the 12 months of suspension, they will have to reapply for SSI. So my question is, why has the agency not used their regulatory authority to exclude disaster relief UI from being counted against beneficiaries?
So Senator Menendez, this is an issue that we are currently looking at right now. I don't, because we're in the middle of analyzing how to proceed, looking at the EIP payments as disaster relief assistance, I'd like to provide additional information for the record. This is an issue that we're currently talking about right now.
Well, I hope we do more than talk about it, because I don't think that Congress intended to provide individuals the type of relief that we did during the pandemic, only to have them lose their SSI. That could never have been Congress's intent at the end of the day. Let me ask you this. Do you support automatic renewal of SSI for people who lost their benefits due to the pandemic with issues with unemployment insurance income when the time comes?
That's another issue that we're looking at in appropriate, the bottom line is in appropriate circumstances. I fully support that.
All right, I look forward to hearing what your ultimate decisions are on this question. Mr. Kozai, for the work your organization and other similar ones do in helping people with severe disabilities applying for SSI, do you have sufficient resources to help your clients?
No, we don't. I mean, we try and make it work with what we get, but it's difficult because each case is different. And so each case requires a different amount of effort and resources to develop and file it. But no, we most certainly could use more resources.
How difficult is the process for people with disabilities who may need some assistance with their applications but don't have access to organizations like yours?
It's almost prohibitive. I mean, I think it was Ms. McGinnis who was talking about the difficulty with like understanding the acronyms and the use of information or terminology that Social Security uses. The majority of people walking around and who are homeless don't really understand the terminology or understand the questions, whereas people who have been trained and who are working in that field, they may look at it and think it's a simple question, but someone who's not familiar with it could get stuck. And so if they answer it the wrong way, then of course, that could result in a denial of their claim or prolonging the process by having SSA send them more information, request more information from them.
Thank you. Ms. Kim, beneficiaries encounter numerous challenges when going through their application process for SSI, and they require assistance from the field offices. But with the field offices closed, many people have been running into challenges accessing this needed help. What is SSA's timeline for reopening offices safely so that older adults and people with disabilities can access the help they need?
So currently, Senator, SSA is operating under its current workplace safety plan, which aligns with the President's executive order and OMB guidance. And that right now permits SSA workplaces to operate up to 25% of normal occupancy. So we are working within the parameters of our workplace safety plan, and that plan does limit our ability to bring in additional staff on site. We've been open throughout the pandemic. I want to make that very clear. But we have only been open to the public if they have an appointment. And we are currently within the parameters of the plan, increasing incrementally staff on site to handle workloads such as critical workloads that serve vulnerable populations. But we are doing that in a way to ensure the safety of our employees as well as the public that has to come into our field offices. But one way that we are also trying to reach the SSI population and help them with their applications is part of the vulnerable population outreach efforts that we've done with community-based advocates that I mentioned in my opening and that I've discussed in my hearing testimony, is that we have established SSA points of contact in every area where we have a field office. And those points of contact are working directly with community organizations and advocates and working with them to facilitate the SSI claims taking and referrals of SSI claims to SSA. And in those instances, we are processing SSI applications.
We're gonna have to move on. Senator Menendez, did you need to say anything else?
Yeah, just very briefly, Chairman, I appreciate the answer, but it's not working for people. I can tell you that. And one of the things we could do is streamline this application, this 23-page application for SSI. I mean, I think in the 21st century, we can do a lot better than that. So I look forward to working with the chair to try to make it better.
Great. Thank you, Senator Menendez. Senator Thune will be coming later, and that means Senator Cardin is up for questions.
Well, thank you, Mr. Chairman, and let me thank you for conducting this hearing on COVID-19 and SSA, and I want to thank all of our witnesses. I want to start by just acknowledging the extraordinary work being done by the SSA workforce. I'm honored to represent the state of Maryland, the principal location for SSA in Woodlawn. The workforce there are dedicated public servants working under very difficult circumstances before COVID-19, which is made even more complicated because of COVID-19. So, Ms. Kim, I want to start and ask you a question as it relates to the workforce issues in two respects. First, we've learned from COVID-19 that telework is a much more efficient way, where appropriate, to use the workforce. And that moving forward, we would hope that there would be a progressive telework policy for workers to be able to be more efficient in carrying out their mission at SSA. On the other hand, you're now bringing more of the workforce back in person, and there's concern that that be done in a way for safety for the workforce. So we had both issues of safety for those who are going to be physically present and interacting with constituents, and those that believe they can do their work more efficiently and safely from their home environment. My question to you is, how are you engaging the workforce? How are you working with the unions for the workers at SSA and the workers themselves? How are they engaged in the discussion moving forward on the policies of telework and safely returning to their workstations?
So thank you for that question. Currently, we are engaging with the union on a number of fronts. So the workplace safety plan that I mentioned, the plan that is kind of the blueprint for how SSA is operating right now, we implemented that safety plan in accordance with the president's executive order, and we implemented that plan in the middle of March. And when we did so, we notified the union and gave them the opportunity to bargain, which we are doing in good faith right now. So we are engaging with the union, bargaining our workplace safety plan, and that negotiation is ongoing. We're also
I would just point out on that issue, just so I could point out, it's always best if you work together in a non-confrontational way to work with the same set of facts. And the way that you sort of presented that, it looks like you presented the plan and now you're negotiating. It seems to me that the union should have been involved in the initial aspects of developing the plan, but I take it they were not.
They were not. This was, we're entering into post-implementation bargaining for the workplace safety plan, but President Biden's executive order and the OMB guidance that followed did permit agencies to move forward with their workplace safety plans because of the health and safety concerns and the necessity of agencies having such plan in place, and then entering into post-implementation bargaining at that point. So that is what we have done in our agency, and we have met our labor obligations by engaging in negotiations with them. Going forward, however, we are actively engaging with the union about issues, not just post-implementation, but looking for their input on a variety of other issues. Right now, the issue of telework is still in the future. That is an area where when we have further guidance from the White House about our ability to reopen beyond the 25% that's currently in our workplace safety plan, we will certainly, and I will certainly engage with the union about any telework program that we put forward in operations, because I want to make sure that that program reflects the interests of our employees.
I thank you for that. Clearly, we had challenges under the previous administration, and I was pretty vocal about that. We expect you to follow up on what you just said. And if you could keep my office informed, I would certainly appreciate that. We have regular contacts with the workers at SSA, and I think engaging them early in the process will make it best for all. So thank you very much for that commitment.
Thank you, Senator Cardin, not just for this, but for your long years of advocacy for Social Security and your constituents. Senator Portman.
Thank you, Mr. Chairman. And it sounds like the COVID-19 experience with Social Security has taught us a lot of lessons, and those have been discussed today, and I hope we have learned from them, including the remote work environment. I want to talk for a moment about program integrity, not just good public policy, but also about being good stewards of hard-earned taxpayer money. In your written testimony, Ms. Murphy, you addressed the importance of fully funding your program integrity activities. For FY22, I see the president has requested $1.9 billion, which is a big increase, $283 million increase over 21. Would you please elaborate on how program integrity activities ensure beneficiaries are well served while safeguarding taxpayer resources?
Thank you for that question, Senator. And yes, the integrity workload is definitely what we want to be investing in, and we want to be making sure that we are paying the right folks at the right time, and that we are reassessing benefits, whether they're medical CDRs, whether they're redeterminations of SSI benefits, not because we want to get people off the rolls, but we want to make sure that we are paying people correctly, and that if they are due benefits, that we are actually increasing their benefits. So having those integrity workloads is very, very vitally important to the work that we do in making sure that once we get somebody on benefits, or if and that they continue, and that they're due those benefits, we can review, and if their living arrangements have changed or anything has changed in regards to their entitlement, they are getting relooked at regularly, and making sure that we're paying people correctly the benefits that they are due.
Can you talk a little about the return on the investment, essentially the $283 million increase in 2022 compared to 2021 as an example? If we were to do that, what would you expect the return to be on that to the Treasury, to the taxpayer?
The return would be that we'd be able to increase the number of medical CDRs, of work CDRs, and redeterminations that we're able to complete. Those take a lot of time. They're one of our biggest workloads. They take a couple of hours for each one of our customers, a lot of man hours to do those redeterminations, but I don't have the number that I could actually put forward for the agency. But I know that if we have the resources, then we can deliver more redeterminations, more integrity workloads, and we can make sure that, again, that we're paying people correctly.
Okay, we'll follow up on that if it's all right, and see if we can come up with some numbers to be able to support this increase, because I think it's a good idea to be sure that the program integrity is working properly, including the CDRs being more available, and you have the resources to do it. And if you have any other ideas on program integrity, let us know. On this committee, the chair and ranking member and others have worked a lot on unemployment insurance, and that's another area where we want to work on program integrity, and I think we have some common ground there to try to figure that out so that the benefits are going to the right people. We've had a lot of issues in Ohio, and I know other states as well with regard to fraud on that program. So, Mr. Chairman, I look forward to working with you on that. On solvency, just quickly, the big issue, Social Security is facing insolvency, as we know, according to the latest report. The old age and survivor insurance could pay benefits only through 2034, and then we see substantial reductions under current law. I know you're not responsible for these actions, Ms. Murphy or others before us today, but what sort of impact would this have on the many clients who your members serve, Ms. Murphy and others as well, if we were not to address this looming insolvency?
So Senator Cardin, I'll respond. I would have to get you more information on that for the record, because I don't have that information off the top of my head.
Senator Cardin would not have asked such an open-ended question. This is Senator Portman's, but
Oh, I apologize, Senator Portman.
well, thank you. I mean, the bottom line is, you know, all of us want to be sure Social Security benefits are there. And today we're talking about administration more, but the looming insolvency obviously would be a huge dislocation for beneficiaries and for the program. Thank you, Mr. Chairman.
Thank you, Senator Portman. And now the chair of the Social Security Subcommittee, Senator Brown.
Thank you, Mr. Chairman, for holding this. I'm committed, as you and I have talked many times, to working together to protect and expand Social Security. Sadly, based on their track record, it appears that Commissioner Andrew Saul and Deputy Commissioner David Black don't share that commitment that Chairman Wyden and I do. We need, and Senator Casey has spoken up, we need leadership that believes in the promise of Social Security, not leadership that has actively worked to dismantle it. Commissioner Saul and Deputy Commissioner Black should resign. Ms. Kim, is a means tested program in a period of economic downturn. SSI should be helping more people than ever. Instead, we find SSI applications and awards at historic lows. Field office closures during a global pandemic, Senator Menendez mentioned that, explained part of that decline. But at the heart of this, we must acknowledge how difficult an SSI application is. You basically need to have a law degree to successfully apply. Here's what I've observed. The Social Security Administration under Commissioner Saul spent a lot of time in regulatory energy making it harder for people to qualify for and retain these benefits. And he's continued that effort even after the switchover in the White House. The president and I want to see a different agenda. Instead of finding ways to deny disability benefits, I want to see you helping people successfully get the benefits they're eligible for. If you would answer this yes or no, will you help shift the focus from denial to assistance? Ms. Kim.
Thank you, Senator Brown. I don't know that I can give you a yes or no answer. What I would say is that I am committed to ensuring that the individuals who apply for benefits, it is easier for them to understand the benefit for which they are applying and the entitlement criteria as well. I want to make sure that whoever receives benefits from us is entitled to that. And we are looking at ways right now to simplify and clarify our programs so that people who are in need of these benefits can access them.
I get that, but I mean, I don't put this on you entirely by a long shot. I put it much more on Mr. Saul and Mr. Black, but you need to do better on this too. Mr. Kozai, if you can answer this quickly from your experience with the SOAR program, which helps the hardest to reach individuals gain access to benefits, do you think we would benefit from a broader nationwide navigator program that would help individuals complete the SSI application process? Be as brief as you can answering that question.
Yes, I do. Right now, for the most part, if a person goes to the Social Security and file for an application, the Social Security Administration will gather records, medical records, and medical records don't tell the whole story of a person's life. And so I think that like organizations like mine that can take the time to develop the case and tell the person's whole story will give the applicant a much better chance at being successful applying.
Okay, thank you, Mr. Kozai. I want to turn to the Social Security workforce. As one of his first acts, President Biden assigned an executive order directing agencies to return to the bargaining table with unions after years of union busting practices. At your administration under Commissioner Saul, this took many forms, including eliminating the option of remote work. According to AFGE, SSA leadership hasn't returned to the bargaining table yet. It hasn't reopened the 2019 agency employee contract. Ms. Kim, why has SSA delayed this process after a clear directive to return to the table?
So Senator Brown, we have actually returned to the table. We are bargaining currently over the workplace safety plan, which right now limits our ability to bring employees in beyond 25% under the workplace safety plan. We are still utilizing maximum telework. So at the point where we get further White House guidance on our ability to reopen, and we are at a point where we can revisit instituting a telework program, at that point, we will be engaging with the union in good faith negotiations about that. And I look forward to that. I look forward to that, actually.
Thank you for that, Ms. Kim. I expect you to double down on efforts to improve relationships with your employee unions. It's something throughout the Trump administration. They were dismissive of unions generally. Their politics was that, their behavior was that, their treatment of workers was that. Another question, though, about the workforce at the time the telework pilot ended months before the pandemic began, was Commissioner Saul working out of Social Security's Woodlawn office personally?
Yes, he was.
Oh, he was working out of the office itself. Okay.
I'm sorry, at the time the pilot ended, is that what you
Yes.
asked, Senator Brown? Yes, he was.
Okay. Thank you, Mr. Chairman.
Thank you, Senator Brown. We'll be working closely with the subcommittee. Senator Cassidy. Senator Bennett. Senator Lankford is next.
Thank you, Mr. Chairman. Appreciate everyone's testimony. Obviously, incredibly difficult season for everyone as we actually walk through the time of the pandemic. No one saw this coming, obviously, and you had a rapid response as everyone else did. As several of you testified, everyone went home for a couple of weeks and thought this would be a couple of weeks, and now we're a year into it. But there are some lessons learned in this. I want to make sure I drill down on a couple of these. Ms. Kim, in your testimony, you noted that express interviews were offered at 81 offices. Some of those offices were actually in Oklahoma. What have you learned from that pilot? What will remain that you have learned from that pilot?
So, Senator Lankford, the express interviews is one of the things that we've instituted during the pandemic to shorten the time that members of the public are in our field offices, and that's out to protect their safety as well as our employees. And we have learned the response to that pilot has been overwhelmingly favorable. And we are rolling out express interviews nationwide because of the effectiveness that process has had in enabling us to process certain transactions more quickly and to be able to serve our customers in a better way.
So obviously, people don't want to spend a long time in the office, pandemic or not pandemic at this point. When you talk about this is something you're going to continue to expand one way or the other on it. And what's your anticipated timeline for that expansion?
We're in the process of expanding now. I would have to add some additional information for the record if you want a specific timeline, but we are in the process of expanding express interviews to all 1,200 of our field offices.
If I can just get a follow-up on that from you. I don't need an exact date, but give me generalities on times and a follow-up after for the record. That'd be helpful, just so we'll know, is this going to take 10 years to implement? Is this going to take 10 months to implement? And so we can get a good feel for that.
I would be happy to do that.
So the disability case processing system has had a few questions, as you know well. The Inspector General has raised some issues. There's some outside third-party groups that have done some audits that have raised some issues. My state has not fully implemented that yet, based on some of those questions and issues on security. Tell me the status on that, because obviously that's a lot of private information that's out there. We want to have a more efficient system that's helpful, but it's got to make sure it actually works and it's got to be actually secure. So give me an update on it.
So in July of last year, Commissioner Saul made the decision to have DCPS as the national case processing system. So since that time, we have been working with each state to transition DCPS to all states. Currently, we have 47 states that are now rolled on to DCPS, and we are continuing to work with those remaining states that are not yet on DCPS. And what we are doing is we're deploying staff to states like Oklahoma to ensure that they have the support that they need to address the unique questions and concerns and issues arising for those states. And so I am confident that we are going to be able to transition all states to DCPS in the next year or so.
Are you confident in the security of the system as well?
I am.
Okay, we will be able to follow from there, but I appreciate that very much in the engagement. There's a lot, again, that we've learned from this time of the pandemic. One of them is how much we've done by remote that we never thought we could do remote. So as we look forward in the future, are there opportunities or an examination at least to be able to look at hiring Social Security employees that may never come into the office, that could work in more remote areas a long way from the office, but could still fulfill those those job opportunities? And I'm thinking especially of people that work that are spouses of those that are active duty, that may be transferred every 2 or 3 years to very remote areas of the country on bases and posts. They'd like to be able to have a stable job and a place to be able to work. Are there job listings that you've seen now to say, we haven't had this as a permanent remote work task, but we could do this as a remote work task in the future? And so are you open to listing it that way on USA Jobs and opening it up?
So we have not made any decisions about precisely that type of job listing, but I am open to considering it because we've learned many lessons during this pandemic, particularly what is truly portable work that could be performed at a location away from the office as if the person is in the office themselves. And so I think we have opportunities as we've identified those workloads that are truly portable to think about hiring future staff who may not ever set foot in a SSA facility.
That'd be very helpful to be able to have a search capability in any office because they could work from anywhere, or to be able to increase the number of highly qualified people that you could actually recruit to be able to work with SSA, because you could recruit them from anywhere. So appreciate that very much. Thank you.
Thank you, Senator Langford. Senator Cassidy.
Hey, Ms. Kim, thank you. And to tag along with that which Senator Langford just asked, I know for passports, the material being used was so sensitive, it could not leave the office. It had to be processed in the office. But when the pandemic hit and the office was shut down, there was not an agreement with the unions for people to wear PPE in order to continue to work. And the only people actually processing passports were management. Did that same situation occur in SSA? Because it seems you as well would have sensitive information which could not leave the premises. First, let me start with that.
So I'm sorry, Senator Cassidy, are you asking whether we had protections in place for employees?
No, whether there was a period of time in which the majority of the employees were unable to come to work because of the pandemic, saying that you couldn't come in, and restrictions upon the union placing restrictions upon the use of PPE to allow these employees to show up. And so therefore there being kind of the pause, if you will, in processing.
We did not encounter that, Senator. At the beginning of the pandemic, and for the first part of the pandemic, the vast majority of people who were on site were managers. So they were non-bargaining employees that were on site. Those were the individuals that were processing the work that came on site, scanning appropriate materials into our systems so that our teleworkers could process those workloads. So we didn't encounter, I think, the situation that you have described. And since that time, we have added about 1,000 non-bargaining staff on site to assist with only those workloads that can be performed on site, and we have not encountered that situation.
So I guess, what I'm interested in, the 1,000 non-bargaining staff and the managers were presumably safe. You would not endanger them, but nonetheless, those represented by the union, their union would not allow them to come on board. First, is that a fair statement? And if so, for how long did the union not allow them to come in?
So even though the union had filed ULPs, unfair labor practices, with the FLRA and has challenged the agency's decision to allow non-bargaining unit staff on site, we're currently bargaining that post-implementation right now. So because of the necessity, the emergency.
I'm sorry, just a second.
And need.
Am I to understand that the bargaining employees are still not on site?
No, the bargaining employees are on site, Senator. So we have about 1,000 non-bar.
For how long did the bargaining employees not show up on site for work?
Oh, I see what you're saying. For probably the first 4 months or so of the pandemic, 4 or 5 months.
And were they able to be fully employed from home? Because I presume you gave them computers if they didn't have them, but some of the material I'm sure would be very sensitive. So how many were actually doing work related to processing and how many were just being paid but not working?
So we had some employees who were unable to work from home because they lacked internet or they had other issues which prevented them from working. But for the most part, Senator, all of the employees, bargaining unit and non-bargaining, were working successfully from home.
And some is an elastic number. Would some be 5% or 45%?
That changed over the course. That changed over the course of the pandemic. We had to work through issues because initially there were some employees who just did not have appropriate internet or at home or no connectivity.
But do you have a percent? Do you have a sense of the percent at the outset? And for how long did that percent remain constant and then begin to fall?
Yes, we do have percentages, and I can share that for the record.
And you can't tell me now?
Not off the top of my head, no, Senator.
Okay. I would appreciate that. With that, I yield back.
Thank you, Senator Cassidy. Senator Thune.
Thank you, Mr. Chairman. Ms. Kim, thanks for the work that you and the agency leadership have been doing to ensure that Social Security continues to provide critical customer service during the pandemic. I know that the chairman covered the issue of mailing sensitive documents at the top of the hearing. I want to echo that I've heard from a number of women in my state who got married during the pandemic and had to mail in multiple documents to change their name. I'm not sure what the chairman was suggesting, mentioning it earlier that this is political. I think it's probably just inconvenient. So I hope the agency will continue to work to expand options as in-person services are still limited. On that note, as we've all adapted to this virtual world, I expect there are things about it we can keep in place moving forward. And I also expect that there are folks who are hopeful to be able to resume their business with Social Security in person as things begin to return to normal. I understand that Social Security's workplace safety plan for field offices provides that the occupancy rate should be no more than 25%. And that field offices have been operating well below that rate. Is that correct?
That is correct.
That is correct. So as vaccines are becoming more widely available, what plans does the agency have to bring employees back safely and increase that capacity to serve customers in person?
So as we've seen the non-portable workloads grow, and by non-portable, I refer to the number of in-office appointments that we are handling right now, and the volume of mail that we're seeing in our field offices, both have grown significantly over the course of the pandemic. I am going to start incrementally increasing staff on site well within the workplace safety plan, but we have to increase on-site staffing in order to meet the demands of the public. And in order to ensure that we are processing the 1.5 million pieces of mail that need to be scanned in a timely manner so that our employees who are working from home can process them. So long as I can do so safely, I plan to incrementally increase staff on site to meet the demands.
Hi, thank you, Ms. Kim. I lost you there. I don't know if the cutout, it was on my end or your end, but if I will try and get that full answer for the record. But I would hope that as things, as everybody gets vaccinated, you can start getting folks operating again in a normal work environment, because I just think the customers that you serve are really anxious to be able to get back to where they can contact you in a direct way, as opposed to having it through all these virtual technologies, which, you know, serve their purpose during the course of the pandemic, but certainly are not as effective when it comes to taking care of your customers out there. Is the one-on-one personal experience, I think, that everybody who comes into the federal government is looking for. So encourage you to as quickly as you can begin to restore, given the fact, I mean, assuming when people are fully vaccinated, to get people back into the workplace. So thank you, Mr. Chairman.
Thank you, Senator Thune. Senator Warner.
Thank you, Mr. Chairman, and appreciate you holding this hearing. I want to build upon what my friend John Thune was just talking about, and how we make sure that we, Ms. Kim, that we get these offices reopened. And again, want to thank you for your 30 plus years of public service. And I know you've got this OMB rule that says you can't put more than 25% of your personnel back in the office at this point. But I don't still understand why that would preclude at least some level of in-person appointments. And again, I know this has been a hard time for you and your workforce, but I am getting inundated with constituents who've got really, you know, heartbreaking stories. I had a constituent named Marie who had a young son, literally a 1-year-old son, had their social security number, had his social security number stolen, and she didn't know his social security number. You know, obviously, as an adult, they could replace it. So she was told she had to, send in all this paperwork, including the original copy of her driver's license, which is just, baffling to me, because she knew if she sent her driver's license in and she had to still drive to work, she didn't have a driver's license, she was going to get fined. And when she finally tried to get something, she said the response was, well, you can file an extension on your taxes, but it just, it is causing some real consternation. And I really do hope you will be, even working with the OMB restrictions, be willing to get more of these in-person sessions scheduled. I also want to talk to you about outreach to vulnerable communities. I know the number of SSI applicants during the pandemic went down, but I'm really afraid about where we're going to go from where we're going to go from here. What kind of outreach are you going to be able to do? Because my understanding is we're a couple million people eligible, and you only send out 200,000 notices of this eligibility. It feels like even with the COVID restrictions, you've got a lot of vulnerable population that's not being told about what they can benefit from. And can you talk about this outreach to vulnerable populations?
Absolutely, Senator Warner. So this is one area that I've been very, very proud of, considering our limitation in the number of people that we can see in our field offices. So over the course of the pandemic, and as I've laid out in my testimony, we have engaged in unprecedented partnerships with national and community-based advocates and organizations. And these organizations and advocates represent and serve the most vulnerable populations. And I characterize our effort as unprecedented because of the breadth and the number of groups with which we've partnered, and the scope and number of initiatives that we are currently working on with these partners. And these initiatives encompass a number of areas, broad-based national and local campaigns to educate the public about how to reach us, the kinds of benefits that are available. As I mentioned earlier, we're establishing SSA points of contact in every area where we have a field office, and those points of contacts are working directly with organizations to help those organizations file SSI claims on behalf of those that they serve, and get those claims to SSA, or to help those organizations let access other types of services for their clients and customers. We're also developing training tools and videos for these organizations as well as for the public and anyone who might be able to assist another person in filing an SSI application or any other kind of claim. And the 200,000 mailers that you mentioned, we're about ready to start that mailer for an additional 1.2 million individuals in June. So we are going to be reaching out to an additional 1.2 million individuals who might be eligible for SSI and invite them to apply for SSI if they think they meet the requirements. And then, as I also mentioned earlier,
Ms. Kim, I think my time is up. I think the chairman wants to move to the next, but I will follow up with you because I appreciate that, 200,000 been sent out, but 2 million are eligible. And, but I will follow up. Thank you, Mr. Chairman.
Thank you. Important point, Senator Warner. Our next is Senator Daines.
Mr. Chairman, thank you. In particular, I want to thank Ms. Murphy for taking the time to join us from Great Falls, Montana. My mom saw her first rodeo when she was 4 years old in Great Falls. So a lot of family memories in that part of our state. And I want to start by commending the leadership and the workforce of the Social Security Administration for their hard work over the past difficult 14 months. They're tough times, and I think the SSA really did step up to the plate. Social Security is really relevant, extremely relevant and important to Montanans, and that's why I care deeply to ensure that benefits are accessible and service delivery is smooth. In fact, when we look at the state of Montana, we are actually one of the oldest states west of the Mississippi. In fact, we're among the top 10 oldest in the country. So this is a very important issue in many ways for the people of Montana. One thing I've heard from my constituents is that they would prefer to have the ability to sit down in person with a Social Security staff member. They tell me it's just not the same to talk to somebody over the phone. Coincidentally, I heard this exact concern just last week from a constituent in Great Falls, Montana. And I think it does make sense from a service delivery perspective to have Social Security's workforce safely return to the workplace as soon as possible. Ms. Murphy, again, thanks for joining us from Montana. Have you heard any similar stories from Social Security beneficiaries in Great Falls? And would you say that Social Security Administration employees would like to be back in the office as well?
Thank you, Senator Daines. I'm happy to be here and happy to be in the state of Montana. And I'd like to tell you that probably in Montana and in my service area, I have 4 offices, and our customers are probably a good representation of customers all across the United States. They like the service delivery options. And so I've got some folks who say, yes, I want to sit down and have a face-to-face. I have others that are very happy and say, oh, I don't have to come in. Great. I'm happy to do this over the phone. So I think the key in Montana and every other state is that we have options for customers, and that is face-to-face service, that is on the phone, that is online, and it's also video service delivery. And in my oral testimony, I said that we have video service delivery, especially in rural areas. We have the 4 reservations are in my service area. We have video service delivery at every IHS clinic there. And so that means folks do not have to travel. They love having that video service delivery option because a customer in the IHS clinic can directly see one of my employees in my office. The problem with that is the IHS clinics have also been closed, so customers can't come in there to have that service delivery channel. So I would say the most important thing is having all of the options, and that's what we want to advocate for. However people want to do business with us should be the option that they have to do business with us, and that includes face-to-face. And as far as employees coming back, I think that's a mixed bag. We were very, very nimble in being able to go to telework more than we actually expected. My employees, particularly in Great Falls, Montana, Havre, and Glasgow, were not excited to be teleworkers. Now they love it. So we've got to balance that as well. The work that makes sense to do teleworking, great. The work that makes sense to do in the office, we want our employees back in the office as well.
Ms. Murphy, thank you. It was refreshing to hear your focus on the customer in terms of their needs and the multi-channel kind of approach you apply towards customer service. Thank you. Ms. Kim, I know you've touched multiple times on Social Security's plan to return to normal operations, but could you talk about the back to work plan that takes into account the regional differences?
So currently, as I mentioned, we are still operating under our current workplace safety plan. So we're limited in the numbers of individuals that we can bring on site. And I want to make sure that anyone we do bring on site will be safe. So those plans to bring additional employees on within the parameters of our current safety plan are really going to be dependent on where the workload need is. So the way the way I am handling how we will be staffing up is really looking to my regional commissioners. They are the primary executive in every region, and they are working with their area directors and
Thank you,
their
Ms. Gibb.
managers.
I'm running out of time. Thank you. Answer my question. I want squeeze in one last question. We hear a lot about scams targeting seniors. We hear news reports from Great Falls and elsewhere in Montana, scammers using local number to target the elderly. These scammers are pretending to be Social Security employees in attempts to get seniors to hand over their Social Security numbers. Ms. Murphy, have you seen an uptick in Great Falls and other parts of Montana during the pandemic with these kind of scams?
Yes, Senator, we definitely have, and how we've been combating that is just basically by communication. Any person who calls us, we routinely are letting folks know, do not give your Social Security number out to anybody who calls. We won't ask you for your Social Security number. They have gotten more and more clever. They are using actual, looks like a local phone number and saying that they're the Social Security Administration. In my particular area in Montana, we also go the extra step, is say the best way to spread the news is to tell somebody else. So tell your neighbors, tell your friends, tell your relatives. Do not take any calls from these scammers. Do not give out your Social Security number. And if Social Security calls you, it's because you've asked us to call you. So sometimes it's just spreading that message.
Thanks, Mr. I think you just did a public service announcement for us. Thank you. Thanks, Mr.
Very
Chairman.
important. Thank you. Senator Whitehouse is next. And then Senator Young. And then Senator Hassan.
Thank you very much, Mr. Chair, and thank you, Ranking Member Crapo, for holding this hearing. And thanks to the witnesses for being here to discuss this important topic. Social Security programs certainly serve as a lifeline to our most vulnerable citizens, and we have to ensure that these programs are accessible. I want to start with a question to you, Deputy Commissioner Kim. A year ago, I helped lead efforts to ensure that Social Security recipients automatically received economic impact payments. Unfortunately, Social Security beneficiaries did not receive their latest automatic payments until more than a month after the American Rescue Plan was signed. I've also heard from constituents who've still not received their automatic payments. Deputy Commissioner Kim, how is the Social Security Administration working with the IRS to ensure that economic impact payments reach beneficiaries who should have automatically received their payments but haven't?
So, Senator, the commissioner is working directly with the IRS to ensure that SSI beneficiaries and recipients are automatically receiving their economic impact payments. That is something that the commissioner has done with every economic impact payment. We've shared information with the IRS to enable them to send the payments to our beneficiaries and SSI recipients. And as we have done with the other economic impact payments, we are providing information to our beneficiaries and recipients on our website. We're working through our advocate groups to share information about how they can get their questions answered about these economic impact payments. And so we're doing everything that we can to ensure that our beneficiaries and recipients will receive those payments automatically.
Thank you. I appreciate that. I will urge you to keep trying to be as creative as you can be and innovate here, because people really do need these economic impact payments and they are still having difficulty getting them automatically. So I look forward to continuing working with you and your agency on it. I want to turn to Ms. Murphy to an issue that the chairman talked about at the top of this hearing with the Deputy Commissioner. Ms. Murphy, New Hampshire is one of 5 states where residents can't request a replacement Social Security card online. Over the last year, with Social Security field offices closed for in-person services, my office heard from a number of constituents who sought to replace their Social Security cards and were directed to complete the process through the mail. It included mailing in driver's licenses, leaving individuals without their IDs for long periods of time. In March 2021, the Social Security Administration permitted individuals to use other forms of identification to meet this requirement, but they still required identification documents to be mailed. Ms. Murphy, how do you think the Social Security Administration can streamline this process as field offices remain closed for most appointments and make this process more accessible going forward?
Thank you for that question, Senator. And definitely that has been one of our biggest challenges during the pandemic is folks that would normally come into the office to take care of a simple transaction, not having that opportunity. And moving forward, I would like to see that we do streamline that process via data exchange, and so that we have opportunities to verify people's documents. Sometimes this has caused us to really relook at our policies and say, why do we have to have this document? So I think we've done a good job of being flexible during this pandemic, and what I'm really hoping is that, and I know Grace is too, is that we'll be able to realize some of these things that we have had to put in place temporarily that really make sense, so that we can serve our customers in the way that is easy for them. And the change in the policy for secondary evidence has really made a huge difference for the constituents in my area and across the nation, because it's easier to get one of those documents and part with it than it is a driver's license.
Well, thank you for that. And I thank you for your service and your work. And we really should just be focusing on our customers, our citizens. So I have one more question for the Deputy Commissioner. On Tuesday, I led an oversight hearing where we discussed the federal government's use of outdated legacy IT systems. The Social Security Administration's reliance on legacy IT and paper-based systems hurts the American people's ability to access benefits, increases security threats to the agency, and creates more opportunities for waste, fraud, and abuse, costing taxpayers money. So, Ms. Kim, how will you work with the Chief Information Officer at the Social Security Administration to execute the agency's modernization plans for these systems? And when can we expect the agency to fully dispose of its legacy IT platforms?
So that is an excellent question, Senator, and operations is working hand in glove with systems as well as other components who all have a stake in the IT modernization efforts underway with SSA. It's why it is so important that there continue to be investment in SSA's IT modernization, because for my employees especially, and this is something that we learned and that was highlighted during the pandemic, we don't have end-to-end systems that allow a customer to seek to do business with us, and then our employees be able to seamlessly from end to end process that transaction seamlessly. Instead, the pandemic highlighted the number of workarounds and stops and starts that we have because of the use of our legacy systems. I don't have an end date yet for when all legacy systems will be eliminated, but we are making headway every day on our IT modernization plan. And I am very, very excited for the opportunity that modernizing our systems will bring operations and all frontline employees.
Well, thank you very much. And thank you, Mr. Chair, for your indulgence in letting us go over time.
Very important question.
It's very important. Thank you.
Yes, thank you, Senator Hassan, and for your good work. We're now waiting for several senators who would like to ask questions. There is Senator Whitehouse. Very good. And I'm going to run and go vote. And we've got several other senators who are going to ask questions. And then I want to make sure we wrap up with clear instructions about what needs to be done going forward. Senator Whitehouse. And thank you, Senator Crapo. We'll go back and forth and keep this going. Senator Whitehouse.
Thank you. I share the concerns of many of my colleagues who've heard from our constituents about a variety of problems that have followed from the transition to pandemic-safe remote work by Social Security. I appreciate the effort that you all have gone through to keep your employees safe, but it has had these effects, and the quicker they can be resolved, the better. Two questions. One is, where are we on finding other ways to have access to people's personal documentation, like passports, for identity verification, because people get spooked when they have to put their passport physically in the mail. Have we solved that?
So Senator, I'm sorry, I had to get off mute. Senator, what we are doing during the pandemic is allowing for individuals to use secondary evidence to verify their identity. The fact of the matter is there are certain types of transactions, Social Security number transactions, that require us to look at primary forms of identity proofs and to meet with individuals in person. That is a regulatory requirement. But
And you
this
can't
pandemic,
adapt that for Zoom? I mean, we're adapting everything for Zoom. This hearing is being done for Zoom. If you've got somebody in front of you and they can show you, wave their passport at you, it seems to me that there are ways to make that work.
there are, for certain types of Social Security cards, we're able to successfully use video to verify someone's identity that way, but those are really no change replacement cards. But for original cards and other types of Social Security cards, the law does require us to verify primary forms of identity proofs, and also to interview the person in person. So, but as I mentioned,
that legislatively, or is the clock going to run out as you come back to work, so that this is a problem that whose horizon is close enough that we don't need to take action?
So we're currently looking at that very issue internally, Senator, and I hope that we'll have an opportunity to revisit the legal requirements for what we need to do to process a Social Security card. But for purposes of the pandemic, we have tried to alleviate the burden on the public by allowing for secondary forms of evidence or identity proofs that don't require someone giving up their passport or their driver's license. So in appropriate circumstances, individuals can use certified medical records or other forms of proof to verify their identity.
Well, I would encourage you to try to get an answer to us within the window that the chairman is going to provide for questions for the record as to what you're going to need, because we don't want to be in a situation in which, because we're not getting a timely answer from Social Security, we end up not taking action that we could probably do with a huge bipartisan, instantaneous, almost unanimous consent on the Senate floor. And then we find out that, in fact, this is a problem that's going to endure for several months and continue to bedevil our constituents. So I think if Ranking Member Crapo and Chairman Wyden could get a clear signal from you within the QFR time about what's needed, we can then respond appropriately and not have people caught in this quagmire of indecision. Separate question for Ms. McGinnis. Just over half of Social Security disability applications have been submitted online in 2020. Is there a way, what do you recommend? Is there anything we should do to be able to make electronic submission of Social Security disability applications more prevalent?
I think it's really important to try to understand the beneficiary's needs. There may be some beneficiaries for whom you will never move them online. There may be some beneficiaries for whom, if the process was more straightforward, it would be easier to move online. And I think a close look at the trends in the pandemic would be the first step in trying to up the numbers of folks. Second is, we found in other benefit delivery experiments that complex online processes can be beat by paper. So you may be driving people to in-person assistance because of the complexity of some online systems. So I think a closer look, really testing with the folks you're serving, understanding what the ceiling is of people who will be able to move online. I suspect with Social Security, there will be populations, as we've heard, that really do need to go into the office. But trying to maximize the efficiency of folks who don't is going to be the first step.
Well, you could, I think, help us if you could make a recommendation, again, in the QFR window of this hearing, treat it as a question for the record from me, if you must, and see if you could make a recommendation that is simple and clear and obvious enough that it would be amenable to unanimous consent by the Senate to work our way through this problem. I know there are going to be some complexities and some difficulties, but to the extent you can follow the KISS, keep it simple, you know what, rule and give us a recommendation, I think we'd be in a position to act on it. Thank you all very much.
Thank you, Senator Whitehouse. Next is Senator Warren.
Thank you very much. When the pandemic hit and Social Security offices across the country had to close their doors, millions of Americans faced delays in receiving their benefits, or they were unable to apply for benefits at all. And this is particularly the case for some of our most vulnerable Americans who depend on the Supplemental Security Income Program, or SSI. SSI is the part of Social Security that serves as a lifeline for low-income seniors and people with severe disabilities, people who otherwise would have little or no income to live on. So SSI is really about survival, and it helps keep more than 8 million people, including 1 million children, afloat. But the program has been neglected for decades now, and it's not providing beneficiaries with the economic security they need. Mr. Kozai, you have helped hundreds of people in your community access SSI. Let me just get your opinion on this. Is the program doing enough to provide adequate support for people with disabilities and seniors with very low incomes?
They're doing, I guess, what they can under the circumstances, but it's not, I wouldn't say it's adequate. There are hundreds of people who need basic assistance that they're not able to get right now for SSI benefits.
All right. Well, thank you. You know, we need to improve SSI so that Americans who are most in need have access to this support. And that's why I've called for increasing SSI benefits to at least the federal poverty line, eliminating the asset limits that prevent beneficiaries from saving for the future, and ending the rules that force people to choose between their benefits and marrying the person they love. Now, President Biden also supports many of these reforms, and I joined several of my colleagues, including Senator Brown and Chair Wyden, in urging him to include them in the American Families Plan. Congress should make good on the president's promises and strengthen SSI now. Mr. Kozai, let me just ask you, would these SSI reforms, increasing benefits, eliminating asset limits, ending outdated rules, would they meaningfully change the lives of the vulnerable Americans that you work with every day?
Absolutely. Absolutely. We have witnesses, not witnesses, but clients, ex-clients who comment about how getting on benefits has changed their lives, has increased their hope in their lives. We've got counselors who work with these people with severe and persistent mental illness all day, every day. And one of them wrote to us and said that they can't tell us enough about how much the change is made in people's lives when they have a stable income. They go from being very stuck and really struggling to quickly making an immense progress. Not only that, you know, it opens doors for people who are living on the street or who are at risk of being put out on the street, who are in shelters and transitional housing units that, you know, are waiting, that are probably on a grant, a short-term grant for housing. So SSI is immense, and when it comes to improving the quality of these people's lives.
Yeah, well, thank you. Thank you for the work you do, and thank you for your up close and personal testimony about this. We need to strengthen SSI, but we also need to make sure that people have the help they need to access SSI and other benefits. SSI applications and awards have been at historic lows during the pandemic, a time when the program should have been helping more people, not fewer. Field office closings are one of the reasons, but another is decades of disinvestment in the Social Security Administration. Congress has starved the agency of funding for years, and its operating budget is now 12% smaller than it was a decade ago, even though the number of beneficiaries is up by 21%. Ms. McGinnis, I'm running out of time, but can you just say very quickly, what have been the consequences of this disinvestment in SSA on low-income seniors, people with disabilities, and other people who rely on benefits?
Senator Warren, the consequences of disinvestment are real and formidable. Low-income families go without food. They are forced to move. They scrimp on life-saving medications that they need. It's really clear that improving the process is necessary, but funding the fundamentals is essential. And state and federal agencies, must have the basics. It doesn't matter if the form is useful if there's no one there to pick up the phone.
Yeah, thank you, and thank you for your work. For people with disabilities who rely on SSI to get by, these investments in our safety net are long overdue. We need to make it easier for people to access the benefits they desperately need, and we need to rewrite the rules of SSI so that recipients have a fighting chance at building some real economic security for themselves. President Biden should do this today. So thank you, Mr. Chairman. Thank you for having this hearing.
Thank you, Senator Warren. And I am waiting right now for Senator Wyden to return. We have a number of senators still on the list, but we are also in a vote. Actually, we are in a process of 4 consecutive votes, and we expect that may cause a number of our senators to be unable to return. Are there any senators who have not had an opportunity to ask their questions who are with us? All right, seeing that there are none, I am going to recess the hearing. I apologize for that delay to each of our witnesses, but I'm going to recess our hearing temporarily while we wait for either one of our senators to get back or for the chairman to return and make the determination as to whether we should wrap the hearing up. So at this point in time, we will be at recess. I see that you have returned. I have put the hearing into recess, awaiting your return. And so I think that if you are ready to begin again, you'll just need to bring us back into order.
You are ever gracious, Senator Crapo, and I thank you. I have one additional question and then a short closer, and we will wrap up. Senator Crapo, do you have any additional questions you'd like to ask?
Nope, I do not.
Okay. Mr. Kozai, thank you again for your good work and all you do to help the vulnerable in Portland. And we've met so many times with Central City over the years. We're very appreciative. And I would be interested in hearing what would be the major changes you would like to see at Social Security that could be helpful to your folks who come to Central City. I noted that you really made the point about the acronyms and all the government lingo and the like. That's just kind of a blizzard of verbiage for people. Are there other things that you think would be particularly helpful for the folks you see at Central City?
Yes, thanks for asking that. I think that if the field offices could dedicate more time or more access for their claims reps with community partners or people who are helping the non-attorney reps or even the attorney reps who are helping people file for Social Security, that will go a long way. Because like my organization, for example, we do our best to maintain contact with our clients. We go out in the streets and find them. We gather all the information that's needed. If Social Security has a request of them, we do our best to make sure that that information gets to Social Security. That's one thing. I think very possibly kiosks in places where homeless populations frequent. That would be very helpful too. I mean, maybe there's a lot that might not be able to be done, but at the very least schedule phone interview times or schedule a phone call with the rep at Social Security to get your questions answered, rather than having to wait on the phone for 40 minutes to an hour or even longer, and then take the risk of, after you've been waiting for a while, getting hung up on because of the technical issues. I think that making the Social Security application definitely, making it easier would be a great help. We have a lot of people who we serve that that start the application process on their own because of the time it takes for us to get to them. And so it would be great if they could, if they started the application process, they didn't make so many errors in filing that application by not understanding what Social Security is asking of them. And then again, more flexible call-in times, more time for the public to actually reach out to Social Security. And I'm not sure, like, I know that there are a lot of organizations that have been working face-to-face with people, like our clinics, or most clinics are, like they have used plexiglass when they're having face-to-face interactions with clients. Very possibly that's something that Social Security could look into. So it's, I just think that during this time, and we're looking at new ways to move forward during the pandemic and possibly after the pandemic. My major point would be that Social Security engages more with community organizations that are helping people file for Social Security disability.
Thank you very much, and we just appreciate all your good work and getting up early to make this important testimony. Ms. Kim, let's kind of wrap up so we have kind of a game plan here going forward, because we know that you're here testifying on behalf of the agency, but there are many parts of the agency that are involved in these issues. First, I believe that it is critically important to end this requirement that some people have to produce the original documents like driver's licenses in the mail to kind of start this process of securing their benefits. And I will tell you, listening to my colleagues today, one senator after another brought this up. I mean, this requirement is just a prescription for bedlam and making lives increasingly difficult when I know that that is not your intent. You have been a professional there in the field for a long time, and I know you care deeply about people. So my first request is I would like a detailed plan, whether it is a tech fix. And it occurred to me, and I do a lot of privacy work, that you have to be scrupulous about protecting people's privacy, but it would seem to me that there are some questions with respect to whether you can get this data from the DMV in a way that protects people's privacy. But the point is, we need a detailed plan with respect to how this is going to get done. Is it tech? Is it appropriations? Is it legislation? But this just isn't right, period, full stop. So I would like to set a 2-week deadline to get from you what your plan is to not force vulnerable people to be sending hither and yon their driver's licenses and these original documents, because that's just unacceptable to me. Can we agree that we will get a plan within 2 weeks on how this is going to end?
Yes, we will get you something, Senator.
Very good. Thank you. Second, I think we already talked about the targeted outreach letters, and you indicated that you would get us the results of the letters and what you all are doing on that as well. Is that still acceptable to you?
Yes, and I just want to reiterate, we're going to start reaching out to the 1.2 million. We're sending out letters to them in
Very
June.
good. Well, why don't you get us in writing what we discussed earlier, the plan for using the data, and you touched on a number of things. I was trying to keep track of them, and I didn't get them all, and so it would be helpful to do that as well. And then the third area that senators were talking about is this 23-page application process where you've got to get people through all of this verbiage and the like. And I think it was you, Ms. McGinnis, that was touching on some of the forms and trying them out on people before you went ahead and the like. And it would seem to me possibly there's a Kim McGinnis alliance here that could figure out how we could get the process simplified there as well. Why don't we say, for purposes of that, Ms. Kim, how about over the next month, you put together for the Finance Committee a plan on how we can reduce the size of all that. And I suspect Ms. McGinnis can be conscripted into working with you and all that. But again, it just seems that it cries out for simplification. Okay? All right. Those are the three follow-up requests, Ms. Kim, and we thank you for being here. And let me again note my respect for, I believe you've been at the agency for 30 years?
That's correct, 33 to be exact.
That is a long run of public service. And we say to you and to the many employees at Social Security, this has been obviously a year like none other. Back in the days where I was elected official, I was co-director of the Gray Panthers. I ran the Senior Citizens Law Service. And I saw so many dedicated people who work at Social Security. And I think our challenge is that the kinds of issues we need follow-up on aren't necessarily going to involve decisions that they make every single day. But we want their input, we want their ideas, and we want to get results for people who are walking an economic tightrope every day in America. So I want to thank our witnesses for their patience, for the information. Senators' questions for the record need to be submitted by the close of business on the 6th of May, a week from today. We thank our witnesses and all senators for their helpful questions. And with that, the Finance Committee is adjourned.